Welcome back to the channel. Today we're exploring the untold story of a rare and fascinating condition, Bloom syndrome. It's a genetic mystery that connects the smallest parts of our DNA to big impacts on health, appearance, and life itself. Let's dive in. Bloom syndrome is a rare genetic disorder, one that affects the body in many visible and hidden ways. People with this condition often have short stature, a sun-sensitive rash on the face, and a significantly higher risk of developing early-onset cancer. It's not just a medical diagnosis, it's a vivid example of how genetics can shape every part of a person's journey. So what causes Bloom syndrome? It all starts with a gene called BLM. This gene helps repair damaged DNA, but when BLM is mutated, the body struggles to fix its own genetic errors. This leads to chromosome instability, a major reason why cancer risk is so high in these patients. Here's what truly makes Bloom syndrome stand out. First, there are very high rates of sister chromatid exchange. This means that chromosomes are swapping parts of their DNA much more than normal. People with Bloom syndrome often have a narrow face, a prominent nose, and ears. Some may also have sparse fat or small jawbones. The immune system is often weakened, so frequent infections are common, especially in the lungs and urinary tract. Other signs include café au lait spots, delayed puberty, and sometimes mild learning difficulties. Each person living with Bloom syndrome carries a story that's as unique as their DNA. Their experiences, dreams, and challenges are shaped not just by their genes, but by their families, communities, and hopes for the future. Doctors usually recognize Bloom syndrome based on growth delays and that signature butterfly-shaped rash after sun exposure. But to confirm it, genetic testing is essential. Modern tools like exome sequencing can find mutations in the BLM gene, and even in other related genes like RMI1, RMI2, or TOP3A. These new discoveries help diagnose even the rarest cases. Finally, getting a diagnosis can bring a sense of relief, because it puts a name to years of questions. But at the same time, it also brings new challenges, from navigating treatments to finding support and understanding what the future might hold. The most serious concern? Cancer. People with Bloom syndrome are far more likely to develop cancer, often during childhood or early adulthood. That's why, regular screening is critical. And because their DNA is fragile, standard cancer treatments like radiation can actually be dangerous, so doctors are now working on gentler, more targeted therapies. There's no cure yet, but honestly, many people live healthier lives with early care and consistent support. That means avoiding sun exposure with protective clothing and sunscreen, staying up to date on cancer screenings, treating infections quickly, and of course, getting nutritional and emotional support. Sometimes facing challenges can feel overwhelming, but having support makes all the difference. It's in those moments of struggle that we discover our true resilience. Remember, you're not alone. Leaning on others is a strength, not a weakness. Together, we can overcome more than we ever thought possible. Now let's talk about what's new. Recent studies show that Bloom syndrome isn't always caused by BLM mutations alone. Genes like RMI1, RMI2, and TOP3A can also play a role. New reports are using trio-based genetic sequencing, analyzing a child and both parents, to catch rare combinations and diagnose cases faster than ever. Meta-analyses have confirmed that sister chromatid exchange and chromosome breakage are directly linked to early cancer development, and researchers are now looking into less toxic cancer treatments that won't worsen DNA damage. Because of its rarity, fewer than 300 cases worldwide, global collaboration is more important than ever. Groups like the Bloom Syndrome Association and ERN Gentouris are helping families, funding research, and pushing for early screening in high-risk groups. Every person with Bloom syndrome is a story of strength, complexity, and resilience. Thanks to advances in genetics, we're diagnosing it earlier, treating it better, and supporting families around the world. Hope is not just on the horizon, it's already here. If this story moved you, or taught you something new, Please like, subscribe, and share. Your support helps us spread awareness and bring visibility to rare genetic conditions like Bloom syndrome. Until next time, stay curious, stay compassionate, and stay connected.